Brother David,
Oh,
could you be able to say a word of prayer before we start and other people join, because we don't want to wait anymore.
surely I will. Father, thank you for this day. Lord, thank you for all the things that you provided. Lord, the things that we can see, we can put our fingers on, things that we think about that are obvious, and Lord, all the things that we have no clue that you have provided to meet us in all types of areas of our lives. Lord, someday we hope to see you and that you can enumerate upon those things. Lord, we thank you for the ability to get together, and as we have done for many weeks. Lord, these are topics that are new to many of us. And Lord, there's enough depth here that there's great amount of wisdom to glean. Father, we pray that you would help each and every one of us to incorporate this into our lives and into our churches, into our church families, and help others with these things. May we have a good night tonight and utilize the wisdom that can be passed on. In Jesus' name, amen.
Thank you, Brother David, for that beautiful prayer. And as people join, we will, I think my camera is off. Okay. Good morning and good evening to everyone. As the people join, we will start the meeting without any delay. I'm so happy to see you all. This is the last class to the concluding session. We will end the sessions next week. And God willing, we may start another session starting February 1st. I will make that announcements once these sessions are over. May I request Dr. Emma to share his thoughts on the questions and answers, please. Dr. Emma.
Yes, thank you so much, Dr. Thomas. And thank you also, everyone who is part of this wonderful class. One of the people that have benefited a lot from the wonderful teaching of Dr. Thomas and the practical sharings from everyone in this platform. The question given to us last week was on mental health and the problem of kleptomania. And that's what I am asked to share about in this meeting. I want to refer to what I submitted. And my response is that the symptoms of mental health problems may include constant sadness, excessive worry, mood swings, anger, withdrawal from friends, poor concentration, and then changes in sleep or eating habits, and loss of interest in daily activities. For example, a student who was once active in class and becomes suddenly quiet, stops doing assignments and avoids friends, may be experiencing depression. That's my own understanding of that. And secondly, the problems in youths and teenagers that may be concerning about their health, and that include common problems among teenagers like stress from school, peer pressure, low self-esteem, anxiety, depression, and substance abuse. And this issue of substance abuse or drug use is a very critical issue that is plaguing a lot of youths in our society, especially here in America. I happen to work in a psychiatric hospital in a section for the rehabilitation of drug addicts. And a lot of young people, teenagers, students, are severely challenged by exposure to overdose and the use of drugs. And so depression and anxiety can set in because of substance use abuse, and then bullying and social media addiction. Not many people are talking about social media addiction. There are people, healthy people, including adults, who are now addicted not only to alcohol or drugs or any substance, but addicted to television, to social media, and all manner of things. And it makes them to be dysfunctional. Even marriages are suffering because couples are partially there, but not available because of addiction to social media. So a teenager who starts skipping school and is using drugs to fit in with friends may struggle with peer pressure and self-confidence. And then the last one, which is number 3, is the issue of kleptomania. Kleptomania and how a person suffering from that could be helped. Kleptomania is a mental disorder where a person feels a very strong urge to steal items they do not need. Even though they know it is wrong, they still go ahead to do it. And they're not doing that for any economic benefit, but because it has become an obsessive, compulsive urge. For example, a person may steal small items like pens or snacks from stores, despite having enough money to buy it. To help someone with kleptomania, we need to encourage counseling or therapy. We need to provide emotional support without judgment, and also help the person learn healthier ways to manage stress and urges. Professional treatment can help to control these impulses. And again, there is something I didn't mention here, but I'm speaking as a pastor and a minister of the gospel. Some of such cases may also require intensive prayer. And in some cases, it may require deliverance or exorcism, because there are certain abnormal behaviors that counseling alone and psychiatry or therapy may not permanently cure. There are certain situations, not all of them, that may require prayer and fasting, deliverance, or even exorcism. Scientific engagement may quarrel with this, but that is a reality that Christian counselors and pastors can attest to. Thank you so much, Dr. Thomas. I will rest my case here for now.
All right. Thank you, Dr. Emma, for that beautiful presentation from your learning and from your work experience. I will be discussing more in the end of the class hopefully, when we start the next course in the beginning of February, two or three of the subjects I am going to deal is youth problem, social media addiction, bullying, all these things, and of course, parenting and other things. So thank you very much, Dr. Emma, for that beautiful presentation. Before I ask Manjula to present her paper, is Pastor Prakash online? Pastor Prakash from Australia, is he online? Yeah, I think he is driving, and it is a vacation time there, and so he's busy. And he sent me a paper which I am going to read. What are some signs and symptoms of mental health problems? Emotional signs, he gave different categories. A person's internal feeling that cannot be fully displayed always. Example, sadness, emptiness, or hopelessness, excessive fear, worry or anxiety, irritability, anger, or mood swings, feeling overwhelmed or unable to cope, loss of interest or pleasure in activities once enjoyed. Having listed these feelings, these signs doesn't necessarily mean someone has a mental health problem. I like to add something to it. The problems can be temporary due to a depression, some life experiences. Some could be hereditary, genetic, and physical related problems. So only a professional can give advice what to do about this situation. Parents usually make the mistake of diagnosing their children's problem. I beg with you, I plead with you, please don't do that. Seek the help of a professional. Cognitive signs, these signs are most displayed partially or fully so that another person can realize a difference in nature. Example, difficulty concentrating, remembering or making decisions, negative or distorted thinking, extreme guilt, worthlessness, confusion, or trouble understanding reality, thoughts of self-harm or suicide. Behavioral signs. Example, withdrawing from friends, family, social activities, staying most of the time in their rooms, and not interacting with the other family members, sleeping too much or too little, changes in appetite or weight, decline in performance at school or at work, increased use of alcohol or drugs, avoidance of responsibilities or daily activities, etc. Physical signs, fatigue or low energy, restlessness or slowed movement, frequent headaches or stomach issues without a clear cause, difficulty maintaining relationships, increased conflict with others, feeling disconnected, numb or isolated from the family or community. What are some problems in teenagers, youths? We must be concerned. Teenagers are in the path of mental and emotional development. Therefore, teenagers and youth face a mix of emotional, social, physical, and environmental challenges. They can find it difficult to understand what an adult is expecting from them. The other side of the problem is that a matured adult is failing to understand how a teenager mind would emotionally function in its growth path. This misunderstanding from both sides would possibly move the young adult and push them to depend on something else which they think can give them pleasure or rest. Example, alcohol, smoking, and drugs. They can also become addicted to phones, games, and even immature sexual activities. Such teenagers may seek love and acceptability from someone else, especially opposite sex, and can lead themselves into a lot of unwanted issues. Other than the above, teens can also face peer pressure, bullying, including cyberbullying, which will end up difficulty forming healthy friendships or romantic relationships. Some teens can also go social isolation, and that is when they close themselves in the rooms or stay away from the church. Or once upon a time, they were singing in the choir, but they no longer show any interest. Any form of isolation is a warning sign. Loneliness and close themselves in a room, depressed, without even socializing with other people. Some of them can be attached to their favorite computer games, which can also lead to life and death issues. They can also undergo lots of moral, spiritual, and values-related struggles. The example, confusion about values, purpose, or beliefs, pressure to conform to negative forms, loss of positive role models. And he wrote about kleptomania, which Dr. Yamaha said, so I'm not reading that one. So we have to be very careful and watchful. I just like to add one or two to what he wrote. In case we start the next course in February, one other thing which I'm planning to do is what is developmental psychology, or what is the developmental stages, what happens to our mind, including body, and what are some of the things we have to be watchful. In this connection, I want to share, maybe some of you have read in the newspapers, in one of the Indian cities, one boy isolated himself in the room. And it came in the newspaper. I think he is still in prison undergoing treatment. And a very good family. The parents are well-known doctors and medical school teachers. The sister is a fresh graduate in medicine. And an aunt who lived. All the four of them were killed in a very brutal manner. But he had shown a lot of symptoms. Locked himself in the room. And I think in the prison he is undergoing the treatment. So watch for any signs. Dr. Vijay, Brother Vijay Thomas, you like to share anything?
Yes, Dr. Thomas, okay. A few reflections, if I may share. So, Dr. Thomas, thank you so much for shepherding us through this one-year course. It's very intense, as well as a lot of knowledge that you have imparted to all of us. So thank you very much for that. From a personal perspective, this course has been a game changer for me. I had not looked at human behavior, let alone my own behavior in a very clinical, objective fashion. As all human experience is subjective, we look at ways and means to understand and communicate our needs, wants, challenges, and aspirations. So when our needs and wants are in direct variance with norms of society or maybe the legal framework, it leads to some form of trauma and correction. So what I want to touch upon today is not what led to the trauma, but what are the actionable steps that we can take so that there is true change and transformation in one's behavior, so that traumatic incident will not happen again. In other words, let us look at it from an action-oriented approach and perspective. So the first thing that leads to transformation and action is the acceptance of reality. It does not matter what the circumstance, situation, or crisis that unfolded. So we have to look at for what it is. We have to be objective, and this requires awareness. And this is where when we don't have that self-awareness, we need professional help, and counselors are a big resource in this regard. And the second step I would say is to get past one's shame or guilt or immediate sense of hopelessness. And in this regard, in my personal experience, I think the biggest aid or strength is the power of prayer. And when I refer to prayer here, I mean not just repeating the words of the prayer or saying it because we want to get it done, more so in terms of the intent, the meaning, and the prayer and the grace envelops us. So that leads to a very strong internal transformation. It's almost like the prayer enters into our psyche and our spirit, and we become one with the spirit when we pray. If we were to look at some practical cases where, for example, people are in the throes of addiction, be it substance abuse or social media, which was just mentioned, or gambling, any forms of addiction, the first step is to accept the fact that you're addicted. And sometimes you're not even aware of that, or you don't want to accept it. So you accept that, and once you accept that, it kind of seeks in, and the next step is to take 100% ownership and accountability for the fact that you're addicted. And in this process of becoming accountable, there will lead to an internal transformation with the power of prayer. So what I would say is, you have prayer, counseling, and a strong sense of responsibility and accountability, and that leads to genuine change. So once the accountability and transformation, takes place, it also needs to be reinforced at regular intervals. And for this, the best way to do that is to have counseling sessions at regular intervals throughout the year, potentially. It takes a long time to transform, and to be in that course is very important, and you need help, external help, along with the commitment that you have brought to the change that you seek. So for me, one of the biggest takeaways from this year's course also was to treat ourselves and others with compassion. And also, I didn't fully realize how much stigma was associated with all the various different forms of mental illnesses. So we definitely need to leave our judgments of ourselves and our judgments of others at the door, and we need to be kind to others. And in reality, when you are kind to others, you are kind to yourself. And when we love others, we love ourselves. And also, when we forgive, we are forgiven. So the important thing is to practice all that we have learned over the last year, every single week in our daily lives. Another practical, thing for me personally about this course was, we went through the course every single week, even though there was travel in between. The course, worked like clockwork every single week, and it's a cumulative effect. So the things that you learn in this course are applicable immediately, they're practical. So we have learned a lot, and sort of it has compounded, over the period of 1 year. And I'm very thankful for that. Another actionable thing we should do is, especially in a church setting or in a community setting, is to have repeats of this course so that we get more reinforced as we go along. So I was very glad to hear that you're going to do the course again in February for extended period of time. So it was, a very, great experience, a lot of learning, a lot of practical things you can apply, various forms of mental illness that you can discern in a family setting, in a societal setting. And I'm very thankful for this course, Dr. Thomas. Thank you very much.
Mr. Vijay, thank you very much for that good words. Thank you for your cooperation and support to the Hope International Mission in many ways. We really appreciate the support you have given in many ways, including financially, and we really appreciate it. Thank you for your good words. And
Thank you.
welcome.
Thank you.
You are welcome to join the next session also.
Thank you. Thank you, Dr.
Okay.
Thomas.
Okay. Manjula, you like to share something?
Am I sharing the practical steps?
Yes, please.
Okay. So I wrote down from what we learned that churches can take in promoting practical steps that churches can take in promoting mental health is to be effectively support the mental well-being of the congregation. Pastors should participate in mental health training. This will enable them to recognize the signs and symptoms of mental health illness and respond appropriately and know when professional help is needed. Integrating discussions about emotional, spiritual, and physical health into monthly preachings, sermons can help reduce stigma. Inviting mental health professionals as guest speakers and addressing mental health whenever appropriate can further normalize these important conversations. Sunday school teachers and parents could also receive basic mental health training to support children and families. Premarital counseling is essential for preparing couples for marriage. Incorporating teachings about marriage and family into Sunday school materials can strengthen family bonds. Encourage open communication within families so members can seek help when needed. As a community of believers, we must eliminate unnecessary gossip or foster just trust among each other. By creating a safe and supportive environment, we can remove shame and encourage individuals to seek help from fellow believers. That's my few points that I wrote down.
Yeah, thank you very much, Manjula. And next week, all of you will have a chance to share what is your recommendations for the people, for the churches, to do what is best so that, as Vijay has said, some changes can take place in our communities, our churches. One thing I like to say, which I may have said it before, the invention of the light bulbs. Anybody remember the name of the great person who invented the the bulbs?
Thomas Alva Edison.
Edison, correct.
Edison, yeah.
He invited everybody, and if I'm not mistaken, something went wrong with the first bulb. If I remember correctly, that the air dropped it or something went wrong. I have to reread that. But he went ahead and produced another one. Look at the world today. Without his commitment, without his dedication, can you imagine our situation in this world today? Previously, people were using the firewood. When I was growing up, I saw that. But nowadays, see what a dramatic change happened to the world. So all I can say, adding to what Manjula has said, please pray with me. Please work with me, cooperate with me, so that our communities, our churches, our organizations, social organizations, receive a wake-up call from their sleep. It's a wake-up call. Thank you very much, Manjula, for that beautiful presentation. And next week, all of you will have a few minutes to share. That is going to be our concluding session. One of the things I want to share today, especially when you see an antisocial person. Antisocial person means he don't care what happened to you. He don't care what happened to the society. He is not having any fear even to kill, even to steal, even to do the harm. He has no empathy for anybody. And some people have a misunderstanding. It is all because of the way they are grown up. So the blame is placed on the parents. I plead with all of you, please don't blame the parents for everything what the children do. Some are born with it. Hereditary factors are there. Genetic factors are there. Physical problems may be there. So please, 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 don't blame the parents for everything what the children do. Some of the parents are very good, I know. They did all they can. They sent them to church. But still they turned out to be antisocial elements. That is where we have to pay very close attention and find a way out. Can we find a way out of all the problems? No. But at least we can try. Sometimes we have to turn away from some of these people. That's another important point I want to say. With the love, we can make changes. Like I have seen people telling the husband and wife, one is doing a lot of wild activities. And we go and tell the wife or the husband, love, love, love. Yes, love is necessary. component. But at the same time, love calls for action, necessary help. Don't feel ashamed. Face it, face the reality. Face it and face the reality. You cannot deny that reality. So we have to be very, very careful when we deal with antisocial elements, people who are harmful. We have to deal it kindly with wisdom. We need love and compassion, and we need wisdom and discernment, what to do and what not to do. But many times we in the churches speak only about love. If you love, you will be wise also to help that person. So by loving the person, use the wisdom also. Now, a few other thoughts before ending this class. To reduce mental health issues, focus on simple lifestyle changes, like getting enough sleep. People have various opinions about it, 6 hours, 8 hours, 7 hours. If you are so concerned, consult a medical profession depending on your age. Maybe 6 to 8 hours sleep. Eating well, eating well. I don't know anyone of you have noticed. I don't look the same like when I started. And my wife is very concerned. She said, your face looks very old. Even though we are eating well. You know why? Not because of any sickness. I purposely control the intake of my food. I must say maybe half what I was eating before. My cardiologist told me last month, Dr. Thomas, don't worry, you will get used to it. So because I started eating like that, my wife also eat the same thing. She said, I look ugly and she looks beautiful. So anyway, eat well, whatever you want to eat. Eat well, eat well. Regular movement, even short walks will help you. Staying connected with supportive people, not with the negative people. Stay away from negative people, supportive people, while also incorporating stress-reducing practices such as deep breathing, mindfulness, which I will touch a little later, listening to music. I hear my wife fight with the Google all the time. Order the Google to play, which music to play and everything. Morning, evening, till we sleep. So that's a good thing because I like music. So spending time in nature, enjoy the nature. I always tell, go to your garden, talk to your flower, smell the flower, enjoy. It's a God-given gift to you. Learning to say no to many things which is affecting you negatively. Try your best, limit the substances, anything, chemical things which you take. Unless it is really necessary, don't take the medicine. Last week, my doctor and I agreed I reduced one medicine. Previous month, when I met the cardiologist, he said, take this medicine only half now because I'm doing well. And practicing self-compassion. Be compassionate to yourself. Don't take too much stress. And seek help if we need it. Move our body. Maybe a 30 minutes. I use my recumbent bike for 30, 31 minutes. At least every day, if possible. My wife also uses it. Then walking, gardening, dancing. I cannot wait till May to start my gardening. It gives me a lot of pleasure. It boosts my mood and it reduces my stress. In my house, I saw some what do you call, I don't know what you call it. He said, one of my Chinese friend was making bonsai. He was very good in making it. And I saw it in his house. We are good friends. When he made a stand and put it, he invited me, come and see it. I enjoyed. So I said, my friend, my brother, how much it cost? He made me another stand and he gave me a lot of bonsai. And I paid only very little. I enjoy it now. Every week I water it. It takes at least 2 hours to water it. And I enjoy doing it. Prioritize sleep. Prioritize sleep in your life. And then we discuss all the other things. And lastly, help other people. Volunteering can help. Like even after retirement, I volunteer with American Red Cross in many ways. Whatever you can do, don't simply sit and watch TV alone. When you need, stay it, but try to spend some time in volunteering, helping other people, old age homes, churches, wherever you are needed. It keeps me healthy. Even though I am retired, I'm very active, extremely active. Next week, with all these classes, I am going to study about the Sunday school materials in different churches to help them maybe to add more subject to it, which can help the young people. Because most of the Sunday school materials are Bible related. But the time is running out. We have to include other subjects into the Sunday school curriculum, like premarital counseling from age 13, maybe 12. Tell them about what mental health is, what you can do. Also about parent, what we call respecting elders. All these things has to be. So next week, I'm going to concentrate on that together with all this teaching I do. Then what the churches can do, these are some practical suggestions. Especially pastors, please pay attention. I plead with all of you. Preach on mental health. It's not unbiblical. Preach on mental health. Address topic from the pulpit to normalizing struggles. Bible has lot of references. If anybody want help, I can help you. Bible has lot of references to speak on mental health. Don't be ashamed. Don't think, oh, how can I preach on it? Not every Sunday, once a month. That's my recommendation. Once a month. Most workshop and host workshop and seminars in your churches. Preferably once a month. Once in 2 months. Let mental health be part of your church. You may remember in the beginning itself, I said, we have 4 different needs. Depending on the sociologist, psychologist, it may refer. I wrote in my doctoral thesis, physical need, mental need, emotional need, spiritual need. What our churches are doing is only the spiritual need. Yes, we are a faith community, the churches, but don't ignore other aspects. Let there be balance. Let there be balance. Then support systems and resources. Seek the help of a licensed counselor, which I already discussed in the beginning. What a pastoral care team can do, counselor can do, or psychologist can do, psychiatrist. Let them be part of your team. Let them be part of the team. If you have somebody in your church trained in counseling, involve them in the leadership team so that counseling can be given. Seek the help of the outside agencies. If anybody don't know how to seek it, I can help you find, at least in America, how to find help. Then run support groups, facilitate groups, example, grief counseling, anxiety, addiction. I told you many times when my wife died, I did not get any grief counseling. My children did not get any grief counseling. And I think we still suffer because of that, one way or other. Because nobody cared for us. Because everybody thought Dr. Thomas, oh, he has all this education, he don't need any help. That's not true. Children who were small, they needed counseling, but not a single person took any initiative. Run support groups in your church. Let that be part of the church. Just like the worship, just like the Sunday school, just like the feeding, let counseling be part of your church ministry. It's not unbiblical. And build a resource list in your church. Make a list. I have a resource list in my office so that if somebody needs it, immediately you can call for help. There are so many help available outside, so much of help available. Then you also must have a referral network. Don't look for referral when somebody is in crisis. Your office should have a referral list. If I need this one, I have to call somebody. Let that be part of the system. Then, community and culture. Our culture has a lot to do with our mental health suffering. Asia, Africa, America is just getting out, not still. Still a lot of stigma. In Europe, create a culture where mental health is not taboo and people feel safe sharing it. One of my burden, one of my hope, one of my desire, we come to a stage, if I have a problem, I should be able to call Vijay, Dr. Emma, Gifty, Joseph, anybody in this group, say, my brother, my sister, I have this problem, could you please help me? But we have to develop that relationship. That is what the faith community is called. We are brothers and sisters in the Lord, then why we feel ashamed? If a family is struggling, that suffering belongs to all of us. So we have to fight against stigma. If we have the stigma, then we are going to suffer for it. Foster connection. Encourage small groups, volunteer teams, and intentional relationship. If anybody wants help, I am willing to help you to start small groups in the church. How to do this? In a proper, organized way. Provide a tangible help, which means assist with the practical needs, like if somebody needs some help with the job, food, or housing. And be trauma informed. Train leaders and volunteers to respond with the compassion and understanding. When I went through some trauma, when I tried to share with few people of faith, you know what they told me? Oh, Dr. Thomas, you can handle it. Don't worry. Just ignore it. Just move forward. That is not the way to handle trauma. Listen, listen, listen. Recently, I read about a doctor. He was a very ordinary doctor, just out of the medical college. He went to a village. I forgot the place. And that was where the government appointed him in a small village clinic. All what he had is some very little medicine, paracetamol, and very little medicine, with no other big facilities nearby. And somebody came with a big family problem. Husband was sick, husband died. This lady is having problem. To some extent, it is a psychological problem. It's a psychiatric issue. The doctor gave some vitamins, paracetamol, whatever he could help. That's all he had. She had some body aches. And next week, the patient came back. Doctor asked, how are you doing? She said, I'm doing much better. Do you know what is the secret? It's a simple secret. The doctor listened to the patient, and the patient felt really happy. Then this doctor decided to go to study psychiatry. So today he is a famous psychiatrist. So he learned something. That's why in the course before we discussed, listening is a gift, I think, given by God. Use it. Listen, listen, listen. And then we have to be watching for anxiety and depression among our people. People who are stressed, addiction recovery, focus, concentration, etc. Maybe next week, few minutes, I'll be talking about the shepherding minds. Shepherding minds. The mind of a shepherd. We are all called to be shepherds of the people. Not just pastor, not just the priest. We all are called to be shepherds of the people. I may talk about it next week. And then I will just close with the last thing which I said. I will say it. We got only a few more minutes. You heard about mindfulness a lot. When Dr. Saji was talking 2-3 weeks back, he told about mindfulness. Mindfulness in mental health is commonly used to treat anxiety, depression, and stress, helping individuals focus on the present moment without judgment, reduce negative thoughts, and develop healthier responses to emotions by fostering self-awareness and self-compassion. And I will just break it down. When you have anxiety, depression, and stress, mindfulness helps us to focus on the present, not the past. Try to avoid negative thoughts. This is all what I can do. This is what I am going to do. Dwelling on the past, yes, at times it is necessary. But if you are going through a temporary anxiety or depression, think of the present. I'm not talking about the deep-rooted anxiety and depression. And it helps to regulate our emotions. It helps people notice their emotions and thoughts without reacting to it automatically, allowing for more intentional response. You all are familiar with the road rage, which is very common in America, very common in many countries. If somebody is taking a wrong turn, we become angry. If somebody crosses our path, we become angry. You know how many shootings happen. You know how many accidents happen because of it. All what you need to do is relax. Let him cut your path. Why you want to add more tension to you by going after him and hitting him, getting into legal problems? Mindfulness-based stress reduction called MBSR. There are programs available. You contact your nearby mental health professional. 4 weeks, 8 weeks, 10 weeks program. Also mindfulness-based cognitive therapy. Short form it called MBCT. Combines mindfulness with the CBT to prevent a depression relapse. Meditation, it helps. Focusing on the breath, body sensations, thoughts and feelings as they arise fast. Especially churches can do it. Sometimes, instead of singing loud, listening to messages, ask the people to sit and meditate on one verse. Give them a Bible verse and ask them to go to meditate on it and come back and share in the church. I encourage the churches to do that. Instead of 4 songs, sing 2 songs. Let the people come and share what they meditated on it. If you have time, sing 5 songs. I have no problem. If you don't have it, adjust your time. The core principle of this mindfulness is to observe thoughts, feelings, and sensations non-judgmentally, reducing automatic reactions and fostering a more deliberate, accepting response to life. Thank you very much for joining this class. I'm sorry I have to rush in 100 mile speed. And please stay once I stop recording. And I want to announce 2-3 things, and then you all are free to go. Just stay for 2-3 minutes, please.